Thyroid conditions or thyroid problems are one of the most misdiagnosed, mistreated conditions that I see in my practice every day. In fact, in the scientific community, the data that we now know, the information we now know on thyroid physiology, I would argue that it's one of the most misdiagnosed, mistreated conditions in America today. So if you have a diagnosed thyroid problem or think you do, this video and this website are going to be critical. The information and the understanding that is going to be critical for you to get better. Without it, you have to trust me on this one, there is very little chance that you will get better, okay, because there are some big time problems with the way it's diagnosed and treated in healthcare today. Okay, so I promise you, if you take a couple minutes and listen to this video and click around this website, I promise you, you'll be blown away by the information that you get. And that information is critical to you getting better. Okay? My name's Dr. Daniel Roney, and I want to welcome you to OrangeCountyThyroid.com, and thank you for visiting our site. But again, it's designed to help you. Okay, so what I'm going to do is go over in the next few minutes about 5 critically important bits of information that you have to have in order to get well. Before I do that, let me just paint a picture for you. Meaning, when I see patients with these thyroid problems, we hear common, complaints, we hear common findings, etc. So most of my patients have been to their doctor, even if it's one of the best doctors in Southern California. They've been to their doctor and they're adjusting their medication, their Synthroid or levothyroxine or Armour thyroid, what have you. They're doing their lab testing. The labs may come back normal or fluctuate from time to time. But the reality is, and here's a biggie, the reality is that you're just not feeling very well. My patients will say, you know what, something's not right. I just don't feel well. You may be suffering with, minor or major, with the following symptoms. You may have fatigue. You may be tired or sluggish. Okay? You may be gaining weight even on a low-calorie diet. You may have stomach issues, whether it's an acid problem or a digestive problem or something like constipation. You may have cold hands and feet. You may have dry, brittle skin and dry, brittle hair, hair that falls out easily, etc. Okay, these are all very common hypothyroid symptoms. Now, again, you might not have them to where it affects you dramatically, but you know intuitively that something's not right. Well, I am going to tell you, and what you'll learn on this video and this website is that it's true. Something is not right. Okay? So that's a common patient that comes to see me with those complaints. Okay? Now, let's talk about the critical information that you need to know. Number one, critical fact number one, you need to know that healthcare, okay, uses a 50-year-old model of treatment and diagnosing of the thyroid. Okay, so again, healthcare today uses a 50-year-old model of treating and diagnosing the thyroid. That is huge because the data in the scientific community that we now know, the information that we now know does not match how it's being diagnosed and treated. So most of you are not accurately being diagnosed or treated for the thyroid. Healthcare is trained, okay? Healthcare is trained to use basically 2 markers for testing. TSH, thyroid stimulating hormone, and T4. Those come back, they're abnormal, and then a medication is administered, usually Synthroid or levothyroxine or Armour thyroid, in order to get your thyroid to be working better. Okay, here's another critical fact. There are at least 5 other markers that need to be tested, plus antibodies against the thyroid to accurately diagnose your thyroid condition. Now, what you're up against is no matter what those other labs, even if you had those other markers tested, healthcare will do the same thing. They will administer medication. And for most of you, okay, you don't need medication. Most of you, and this is my lead into my next important fact that you have to know, most of you do not have a primary thyroid problem. And science and the latest information that we know about the thyroid backs this up. The top experts tell us that most diagnosed thyroid conditions today do not, most people diagnosed, I should say, do not have a primary thyroid problem. What does that mean? This means, and again, this is very, very important, this means that you have a secondary problem. Something else is going on that's causing your thyroid to malfunction. Okay? So, if that's the case, and you're taking medication, the medication is not going to do much because it's not addressing the other problem. Again, latest science, latest information the experts now know about thyroid physiology in the scientific community tells us that most of you do not have a primary thyroid problem. In fact, about 90% of you don't have a primary thyroid problem. You have another problem that's causing the thyroid to malfunction. Here is a fact that you absolutely need to know because this is the dangerous part. The medication that you're taking for your thyroid problem, if you truly don't have a thyroid problem, and 90% of you, according to data, do not, it could be causing your thyroid to burn out. So if I'm taking thyroid medication to stimulate my thyroid to make more hormone, but yet I don't need that medication, it will eventually burn out my thyroid. That is critical to understand because that's a big, big danger. Your medication could actually be causing, with a lot of you, could be causing thyroid problems. Okay, that's huge. Okay, so let's talk about what other things could be going on, right? There are 6 patterns, okay, 6 patterns of thyroid dysfunction, 6 common patterns of thyroid dysfunction, plus something called Hashimoto's thyroiditis. Let's talk about, before we talk about the 6 patterns, let's talk about Hashimoto's thyroiditis. Hashimoto's, again, according to the latest science and information that we now know, constitutes most of the thyroid problems in America today. It is an autoimmune condition. And what that means is your immune system is attacking the cells and tissues of your thyroid gland. Now, if it is an autoimmune condition or immune system imbalance or dysregulation, that is what has to be treated. So in order to get the thyroid better, we need to treat the immune system so it doesn't continually attack the thyroid. In healthcare today, the only thing that's done is for the doctors to administer Synthroid or levothyroxine or Armour-Thyroid if they even have diagnosed you with Hashimoto's. And again, it is not a thyroid problem, it's an immune system problem. Okay? That is critical for your understanding. Now, let's look at the 6 other patterns. The 6 other patterns of thyroid dysfunction, of those 6, there's one called primary hypothyroidism. Primary hypothyroidism constitutes maybe 10% of all the diagnosed thyroid problems. Some publications even less. What that means is primary hypothyroidism, if you have that and you've been diagnosed with that, you will need medication, okay, because the thyroid's just not working real well, and that medication will help you tremendously. Okay, but again, that only constitutes a small number of you. The rest of you have one of the other 5 patterns of dysfunction. And just like Hashimoto's, those other patterns of dysfunction are not true thyroid problems. So most of you are taking medication, upwards of 90+% of you, that's not doing any good because you have one of these other patterns. Now, I'm not going to go into, for intent and purposes of this video, the biochemistry behind that, but just understand some of the other problems, and I put these on the site under other causes, could be a pituitary gland problem, a little bit slow due to excess stress. You could have a problem converting T4 to T3. Again, you don't necessarily need to understand these things just yet, but just know that there could be other problems, and for most of you there are, because data and science backs this up. For most of you, you have something else going on causing the thyroid to malfunction. So again, big picture, if you're taking medication for something that's not truly a thyroid problem, you're not going to get better. Okay? You're going to still have these problems and symptoms and signs because the problem is never addressed. The medication is not going to take care of the other causes. And again, science tells us that 90% of you have other causes. Okay? So that I told you, this video, you'll probably even be, most of my patients come in a little bit perturbed because they ask, well, why doesn't my doctor know this? How come this isn't well known by my doctors, even the best in the country? Because they're not trained that way. Okay? They're not trained. They're trained to look at a couple markers and prescribe medication. Okay, excuse me. And that, as simple as I can put it, that's what you need to know. They're just not trained that way. But I'm telling you, the latest science and the data backs this up. There's hundreds and hundreds and hundreds of references that I have in my office right now, but my education over the last couple of years, I'm getting the latest science and data on thyroid function to be able to help you when not many other people can. Okay? So I know that's a lot of information, but I just wanted to give you some important facts that you absolutely need to know. Okay? Your options from here are twofold. Number one, you could come see me in my office for 2 free visits. I offer 2 free visits. I explain that. If you click on 2 free visits, it explains why I do that. Essentially, I need to know if I can help you first and foremost. So that's why we do that. And then I want you to come in and get comfortable, because I know a lot of you are very skeptical. I understand that. Okay, I truly, truly understand that. So for no obligation and for no out-of-pocket monetary financial obligation, you could come see me and we can talk. Okay, you'll find, I think you'll be pleasantly surprised with everything. So you get the 2 free visits if you like. Also, you could order a DVD from me that I go into some of these things in more detail. It's about 30-35 minutes long, and I explain via the science behind it. It's a little bit involved scientifically, but at least you get the data behind what I'm talking about, and you have that option as well. So either way, I hope this information was helpful. I wish you all the best, but I know one thing. Healthcare today does it one way, and the science and data does not back up the way it's done. So you need help. Okay? So get informed, get the information, and I guarantee it'll help you tremendously. I wish you the best, and if there's anything I could ever do for you, please call. Thank you.